welcome everybody to our May edition of our Healthcare Innovation and Leadership webinar. We started our Innovation and Leadership webinar for healthcare professionals in January as a means to inspire, motivate, educate, and also help healthcare professionals understand the basic principles of innovation, leadership, and entrepreneurship. As a media brand, our focus as a media brand is innovation, leadership, and entrepreneurship in healthcare. So whatever you see us doing is just a part for the major thing we do. Yeah, so our focus is whatever we do, our articles we publish, our webinars, our outreaches, it's just to inspire healthcare professionals, especially in Africa, with knowledge, insight, mentorship in the almost forgotten field of healthcare leadership, healthcare innovation, and healthcare entrepreneurship. Yeah, and today we have Luke Barasa, who's a very, 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 very important figure in the healthcare innovation and leadership landscape in Africa. In January, we had Dr. Onyeka Uga, who's a pharmacist innovating in the pharmaceutical industry in Nigeria. And in March, we had Dr. Akinbade Oluwadamilare, who is a nurse with a PhD, founder of Nurses Scope. He's more into research, education, academia, and mentorship. And today, we're having Luke. I'm going to introduce Luke now. So yeah, Luke Barasa is a healthcare strategist, innovation leader, and accomplished entrepreneur with a strong track record of scaling health solutions that transform care delivery across Africa. He combines deep operational expertise with a passion for digital health and sustainable business models, making him a key voice in Africa's healthcare entrepreneurship ecosystem. Currently serving as the head of country operations at Zipline, Luke leads national scale programs that use cutting-edge drone technology to improve access to essential medical supplies. As a principal consultant at Signal Consulting, he works at the intersection of innovation and impact, guiding health startups, development partners, and public sector actors in integrating digital tools, expanding market access, and strengthening health systems in resource-constrained settings. With a bachelor's degree in biomedical science and technology, a master's in public health, and ongoing MBA studies, Luke brings a unique blend of clinical, public health, and business acumen. He's also a faculty fellow at Innovate Health Africa, where he mentors emerging innovators on commercializing healthcare solutions, shaping sustainable ventures, and navigating the challenges of Africa's complex health landscape. Luke's leadership reflects the core theme of this webinar, building resilient, scalable solutions and empowering African healthcare professionals to take bold entrepreneurial steps toward transforming the future of healthcare in Africa. Yeah, so if you follow innovation very well, I happen to have studied a bit about Zipline, and I'm really impressed with the work they are really doing. Honestly, it's very innovative because nobody really has really thought about drone technology to bridge healthcare gaps in Africa, and it's really working. It's really working. I think we're trying to do an article on Zipline one time. I was thinking about it. I wrote it down somewhere, and I think this webinar will spur us to do some publications or posts on Zipline. Yeah, so I'm very happy to have Luke in the house today. And as we know, our topic cuts across understanding leadership, a bit of innovation, and entrepreneurship. So how healthcare professionals in Africa can understand the intersection between entrepreneurship, leadership, and innovation, and how they can turn their ideas into commercialized products, not just a hobby or just an idea, but what paths can you take? What paths can you take? What definite paths can healthcare professionals take to go to the level where their ideas become productive? Like the ideas help people, one, and the ideas also become economically important in their locality. Yeah, so you can see that Luke has the required expertise, the experience, and the exposure when it comes to this kind of discussion. So in our webinar, we try to bring experts in healthcare, preferably healthcare, people who have background in healthcare, that healthcare innovation professionals, who are there, who are actually building something to talk to us. And now in a few minutes, we're going to allow Luke to drive us. We're going to allow him to educate us, to inspire us. Okay, can you hear me? Yeah, so I had so many pages. I had so many pages open on the laptop, so close some for me. All right, so I'm going to allow Luke go ahead with. He has a slide prepared so that he can go ahead and start. All right, Luke, the floor is yours, sir. Go ahead, please.
Thank you very much for having me and inviting me for this webinar. Allow me to share my screen. First of all, I would want to really echo what you said in terms of the significance that we have as the people within the healthcare space to inspire generations, inspire peer healthcare workers in terms of thinking through what innovation is, how do they blend their clinical expertise, and how do they even go to the business aspect of healthcare and make it a successful venture. Traditionally, the training around medicine and healthcare courses has been more focused on impact. And it has made us look like when you're a healthcare professional and you talk about business and profits and revenue generation, the society will perceive you in a different perspective. So it is our role to rise up and be able to correct such misrepresentation of facts so that the healthcare workers can understand what role they play in the healthcare ecosystem in terms of building sustainable businesses and also being able to drive the kind of impact that we want to see within the healthcare system. And in our context, our discussion is actually African focused. I'm looking at innovation, entrepreneurship from an African perspective, because I want to believe that for centuries, African professionals in the healthcare space have always lended the expertise or the role of building healthcare businesses, innovations, and all that to the outside world. And that's why we've been kind of borrowing the future from developed nations, depending on foreign aids and all that. And we've not been able to build any sustainable models for the longest time that we've been getting this support. So it means that we are in a generation where it's actually mandatory that we're able to rise up and look at what should be done within the space that we are operating in to be able to cause the impact that we want, and at the same time, be able to build solutions which are going to be sustainable beyond our lifetime. So I'll run you through the slides that I have just to make sure that the flow of how we are thinking about innovations, opportunities, and what we are supposed to do is very clear. So I've divided the content into two, just to provide a brief overview of the African health landscape, how the systems are working, what are the basic foundations of entrepreneurship that you need to know about, what are the barriers that we have day in, day out within the African health ecosystem, And then now the second part of our presentation will be more of what is this burden of leadership for us as healthcare professionals, and what exactly are we supposed to do. We're also going to look at some success stories who have done or who have built successful ventures in our lifestyle, and what can we learn from them. Then now we'll finish off with the call to action. What next? What should we do? And which kind of steps should we be pursuing so that we're able to build the innovations that we want to build within the African ecosystem? So we know that for the longest time, we are reminded of the disease burden in Africa. And it is true that 24% or even more of the global disease burden falls within the African countries. If you look at our workforce, we're only having 3% of the world's workforce. The ratios don't make sense. If you look at the expenditure that we have in terms of how much our governments are spending in the healthcare delivery, is only less than 2% of the total GDP that's being spent on the healthcare related services. This one should be our first alarm in terms of we are not in a good state, because if we are bearing 24% or even more of the disease burden and only 3% of the workforce is located in Africa, the doctor to patient ratio automatically is not linear to what even the recommended standards are. And if you look at also the expenditure perspective, we are investing less in the healthcare system. So that means we can't really get the quality that we want. And then at the same time, we can't get the equity that we are driving for. Most of the nations will be talking about universal healthcare coverage and all that. But if you're not investing in the healthcare space, then it means equity remains more to be a dream. 43% of Africans at least don't have access to quality essential healthcare services. This according to WHO in one of their reports of 2023. If 43% of the population within Africa does not have access to the quality care that is required, then that means that as healthcare professionals, we know that our impact hasn't actually reached where normally the desire is for it to reach. If you do a projection of what will happen in the coming years, we anticipate that the population within Africa is going to double by 2050. So we are approximating to be more than 2.5 billion people within the African continent. With that one, it comes the greater burden of providing the required healthcare services and of high quality. So that one again sounds as the second element in terms of the healthcare professionals being the ones to show up and close the gap in providing the quality services required. Most of the time, when we talk about the healthcare landscape in Africa and the challenges and all that, people will mention many things, but I've tried to just pick out like three major challenges or unique barriers within the healthcare ecosystem in Africa. The first one, fragmented supply chains. We understand every time we talk about equity to care, universal healthcare, and all that, the bigger question becomes how can I access essential medicines, essential services, and all that. Supply chain in Africa is not unified the way an ideal system will run. So that one becomes our barrier number one in terms of what are some of the bottlenecks that make us not to achieve the type of care that our people deserve to have. The second one, our infrastructural systems in Africa are underfunded. We saw we're only investing less than 2% of the whole GDP within the healthcare space. So we have a lot of underfunding when it comes to the systems that we should be putting money in to run an efficient healthcare system. Then, of course, the third one that, of course, we've learned hard lessons through early this year is the reliance on foreign solutions and foreign aid. Without investment, you have to go borrow a solution from somewhere else. And that means it comes with some other dependencies, foreign investments, foreign money, and all that. When it is withdrawn, we kind of end up in a mess that we are in at the moment, where most African countries and governments are trying to close out the gap. But we saw this one coming. So that is one of the challenges that we still have in our generation in terms of reliance on foreign solutions and foreign investments for us to run our healthcare system. But we have a promise. As much as these challenges are existing, digital health has opened a new avenue where we believe we are going to really achieve healthcare equity. Um, Primarily, we've seen solutions already which are trying to close the gap in terms of access to care. For example, the telemed platforms. We've seen most countries are able to utilize even the minimal doctor to patient ratio that is existing to provide healthcare services to the wider network of the society that they have. So they are leveraging telemed platforms to be able to close the gap when it comes to access to quality care. We've seen more other solutions. For example, use of drones for remote access to medicine. That's another innovation that has come up within the African continent and is trying to use digital health solutions and systems to be able to close out some of the gaps that we are seeing in the healthcare space. So digital health is presenting a promise in terms of it's an avenue that can be leveraged on to be able to really close out some of the gaps that we've mentioned in terms of the fragmented supply chains, the underfunding that we are seeing in the infrastructure system for the African space, and at the same time, closing the gap in terms of borrowing the foreign solutions that we need for us to be able to run the African health ecosystem. So I've given some examples in terms of what is working in terms of innovations in within the African space, and also what are some of the institutions or initiatives which are taking lead in terms of facilitating this. One of the best examples I would want to call out is Africa CDC. They are pushing for what they're calling the new public health order. If you look through some of the priorities of the new public health order, is that countries are able to put in systems for first pandemic preparedness, and second, leveraging on digital health systems to be able to support the infrastructure within those countries. So that's a very futuristic thing that if we are able to achieve the goals which have been set, then that means we'll be able to bridge most of the gaps that we are seeing currently in our system. What does the digital market in Africa look like? So as we know, the world is shifting towards digital health ecosystem. In Africa, as of 2023, the projection was that 3.8 billion was the total market size of the digital health space within Africa. But this is not enough. If you look at the projection by 2030, we are projecting that year on year, the growth rate is going to be 23%. This is the compounded annual growth rate according to Africa CDC. So that one means that by 2030, most of the market size when it comes to the healthcare business is going to be within the digital health space. So for innovators, for healthcare professionals who are thinking about going into health business, the promise actually lies in the digital health space. So the big question becomes, are you able to innovate? Are you able to build something within the digital health space that can be used to supplement the brick and mortar delivery model that we are having currently? Because in few years to come, with the growing youthful population, the consumption of healthcare services is changing. That's why you see telehealth platforms are the ones thriving when it comes to people being able to conveniently access most of the healthcare services. So the market space in digital health is big. It's growing year on year, and it is like the best medium at the moment to look at building something within the digital health, within the healthcare space that would ideally be sustainable. So basic understanding of healthcare entrepreneurship. We know entrepreneurship is more of you are fixing a problem that's existing within the society or your space through either an innovation or a new system or a new initiative. From a healthcare perspective, you have two entities to consider when you're talking about healthcare entrepreneurship. The first one is you must understand where the problem is. So we have the mapping of what are the challenges existing within the health system. That's part one of it. Then the part two of it will be you're able to create solutions for the challenge that you've mapped. Remember, the challenge can be existing, but it's not a priority. So as you're mapping the healthcare challenges within the system, you're also able to look at what the priorities look like and now be able to create a solution that you know is going to be fast, sustainable, is going to be scalable, and is going to be culturally appropriate. I think we're going to look at why those three factors matter more in our presentation as we go along. So if we were also to define digital health entrepreneurship, so we're just doing kind of a small caveat from the normal healthcare entrepreneurship, where now with digital health entrepreneurship, you're looking at doing the design, implementation of tech-driven solutions for healthcare challenges. So we are retaining the same healthcare challenges. And the goal is that we are going to impact service delivery, patient outcomes, and system efficiency with the entire aim of strengthening the health ecosystem that is existing. So digital health entrepreneurship is introducing the technology component that general health entrepreneurship doesn't have. And if you remember well, just in our previous slide, we projected what the market size for digital health business looks like. So if you're innovating within this space, then you know where exactly to go when it comes to the solution that you're providing. What is the promise again with digital health entrepreneurship? Through it, we can be able to address most of the gaps existing in healthcare delivery. For example, we talked about the shortage in workforce. We can do that using telemedicine platforms. We don't need a doctor to go everywhere. We can use one doctor to serve 20 emergencies in a day without moving to those locations physically. So we are able to use digital health entrepreneurship to be able to fix some of the access gaps that we are seeing in terms of service delivery. The second one is being able to promote self-sustaining financing. The biggest problem we have within the healthcare system is healthcare financing. Who is going to pay for the service being provided? Or who is going to pay for the solution that is being provided within the healthcare system? If we're able to leverage on digital health entrepreneurship, then we have a wider avenue for us to be able to build sustainable financing models. I'll give you some best examples. We have one innovation in Kenya called MTIBA. So what these guys do, they use mobile health, mobile wallets to be able to encourage communities to save towards their healthcare. So as much as the government is having the National Health Insurance Fund, but we know that the informal sector might not be able to afford the National Health Insurance Fund. So a group of innovators came together, they got funding, and they're able to build a solution that encourages people to save the small amount of money they have towards their healthcare. Through that, we're able to build sustainability in terms of financing, access to the services which are being provided already within the system. The third one is enhancing economic growth. Of course, we know that through digital health entrepreneurship, we are creating more jobs, we are creating a healthcare, a more healthy population. Then through that, we're able to boost the economy because we are creating jobs. That means that more people have revenue and the tax bracket, of course, grows for the government to be able to collect more revenue and be able to reinvest in other ecosystems of the country. So that gives us like the basic understanding of what is this healthcare entrepreneurship that we're talking about. What are some of the things you need to keep in mind as you're thinking about healthcare entrepreneurship? What are some of the key benefits that we can get if we were very focused on digital health entrepreneurship? For healthcare workers and healthcare professionals like ourselves, we are encouraging ourselves again to go into healthcare business. That means we either innovate or we find a way of adopting solutions which are existing. So let's take an example. We are innovating or we are building a business. there are two sides of the coin. The business can succeed or the business can fail. If the business succeeds, we are good. If it fails, a problem. But now, what are the precursors of the business failing if we don't understand exactly what are we providing? And that's why when you're building any business, particularly within the healthcare space, there are 5 questions that we need to answer. The first one, what problem am I solving? By virtue that we are in the healthcare space, we already know what the key pain points are. We know what the system challenges and gaps are. And also we know the priorities of our countries or the ecosystems that we are working within. So it's very easy for us to innovate because we're actually the ones running the system. So we need to answer the question of what problem are we solving? For example, are we solving a data problem within the healthcare system? Are we solving an equipment problem? Or are we solving a service problem within our ecosystem? I'll use most examples from Kenya because of Kenyan by default. So in 2021, during COVID, one of the biggest problems the world faced was lack of medical oxygen. And the companies which were providing oxygen at that moment, of course, they made a lot of profits. But even facilities had money, but they couldn't access oxygen because the production was way lower than the demand. And also we had a challenge in terms of where exactly is the production happening. In Kenya, there's a company that was born because of that. It's a social enterprise. It's called Hewatele. So what these guys are doing is they're trying to build kind of low capital oxygen producing plants in different places within the country so that even the smallest facility that has the right infrastructure and needs medical oxygen, they can be able to get it. So if we were to go back and ask ourselves what problem these guys are solving, it's very clear that they identified a problem during a pandemic and they realized that this was not even a pandemic problem, it's a problem that has been existing all along. And now through that, they kind of identified their niche market that they are now focusing on and providing this solution towards. So when we're asking ourselves the first question, in other words, we're identifying what is our niche market? Where are we going to operate in? The second question is, what solutions exist currently in the market for this problem? Again, I'll give you an example using the fintech space. Everyone is building a payment system. From Nigeria to Kenya to Ghana to all the places, everyone has a payment system. We are targeting the same customer. We have 20 solutions in the market. If you actually did an analysis, we'll go back and collapse all these systems into one. Because in one way or the other, they're just replicating the same model and all that. So it's very easy if you're able to ask ourselves, apart from what we want to do, the idea that we have, what is the solutions existing in the market? Through that, we'll be able to identify who our competitors are. I think primarily because we are healthcare professionals and we are working within the healthcare space, we might have the presumption of we know these other solutions are not working well and all that. That's why we want to build something. But it's very clear. It's very good for us to ask ourselves the tough question of who are we going to compete against? What are they building or what do they have in the market? And through that, we are going to really identify, even if we were to go ahead and build something, what will be our unique value proposition? What are we going to build different from what is already existing? The third question we need to ask ourselves is, how big is the problem and for how long will this problem exist? Most innovations which were built for COVID, they are dead. They don't exist at the moment because they were built to solve a time-bound problem. So when the problem no longer existed, no one is now focused with those solutions anymore. In Kenya, I don't know if that happened in the West African countries. With COVID, we had many companies producing medical masks, the surgical masks. Everyone was producing surgical masks. We had even other bigger companies which pivoted into vaccine production. But what happens when the pandemic fades off? The whole investment that was put in the production line is going to collapse. We are not encouraging that people should not build solutions for the pandemic. You need just to be aware that this kind of problem that you want to solve is time bound. So through that, you're also able to kind of estimate what your market size is, what sustainability will be, and which kind of capital investment you need for you to build that particular solution. The fourth question is who will pay for the product? Again, this is the, I think all the four questions, this should be the most important question that you answer when you're building health businesses. I've seen companies or innovations building a very good solution. By the time we bring it to market, we cannot answer who's going to pay for it. Is it the government? Is it the patient? Is it the health, the hospital itself going to pay for it? Is it donor money that will come and pay for the solution? If we are not able to define who exactly is going to pay for the product, then that business is dead on arrival. For us as healthcare professionals, we know that we are not good business people, and I'm putting that quote unquote. But it's very important that we are able to do the analysis and answer the question of who is going to pay for our product, because through that, we're going to identify who the exact client is. And you're also going to identify which kind of business model has to be put in place for us to be sustainable within the space that we are venturing into. The last question that we ask ourselves is, what do I need to get there? So you have your idea, you've done all the validation, the market is big, you have a competitive space, it's a sustainable thing, it's an existing problem for life. You know, maybe the hospitals are the ones going to pay for it. Now the bigger question comes in, what do I need for me to see this solution in the market? Through that, you're able to identify the resources you need, the strategy you need to put in place, the team that you need in terms of like the skill set you need to gather for you to really build whatever you're proposing, plus many other dependencies that will make you either succeed or fail. So if you're able to ask ourselves the 5 questions as healthcare professionals, then you're going to gauge our readiness in terms of the ideas that we have and how soon we can take them to market or build something and be able to run a pilot for it. So those are the 5 questions. Then I also wanted to touch a little bit about what sustainability in terms of the solutions look like. When you're talking about healthcare business, healthcare entrepreneurship, the bigger question we need to ask or answer is how sustainable is what we're building? We've mentioned it already, but sustainability should be thought about from 3 angles. The first one is economic viability. The second one is social acceptance. And the third one will be environmental adaptability. Now, if you build something that your client cannot pay for, you're not going to succeed. If we start a business, a healthcare business, let's take even a practical example. You are introducing or you're building a hospital in a low resource setting, and you're offering very high premium services to the extent that your immediate consumers won't be able to afford the solutions you're providing. However good they are, that business is going to fail because the economic viability is not there. The social acceptance, you need to think about it from different angles. Digital health solutions are kind of associated with some misconceptions in the societies where we tend to operate. For example, we have some cultural misfits that might make it very hard for you to operate. The best example would be telemedicine platforms. When they started off, You wouldn't trust that someone without a doctor seeing you physically, they're going to give you the same diagnosis that they would when you are to physically go to the facility. It's that misconception still exists up to now. So it is a social norm that would affect the outcome of whichever venture that you're building. So you need to ask yourself in terms of sustainability, what social factors are going to affect the business that you are building, and you're able to identify all of them so that you know these are potential risks that you'll have to navigate as you're building the business or you are working within this healthcare ecosystem. Environmental adaptability is quite straightforward. Further to that, you can also think through sustainability, referencing to three components. The first one would be how easy is the solution you build from a tech integration standpoint. If you're building a digital health solution, and or let's say you're building a health business, let's take out the digital health part for now. You're building a health business that cannot be integrated with tech solutions existing. That's going to be very hard for such a solution to be scalable. Then the second part of sustainability would be, is this solution community led? Is it owned by the communities? In 2023, should be 2023 if I'm correct, the World AIDS Day had a very big vision, or like vision statement, which was let communities lead, because they realized that they have done they have done programming for the longest time ever from the bigger offices. We do that in the healthcare space. You have a solution you want to bring on market, or you have an investment where you need to fix a particular solution. We sit somewhere and build something and take it to market. And we expect that communities are just going to take it and they adopt it and they use it. The reality with the world now is, if the communities are not involved, or if your end user is not involved, then it's going to be very hard for you to be sustainable within the market. You have a competitor who comes in and goes the community centered approach, they take you out of the business, no matter what kind of services you are providing. Unless maybe if you're a monopoly, which I don't even think monopolists exist within the healthcare space anymore. The third part of it would be the policy alignment and the support. Of course, we know the kind of policy challenges that we have, particularly within the healthcare space. Data privacy, data transfer, data sharing, all those hurdles that we are having within the healthcare space. So as you are thinking about how sustainable you will be when you're building a health business, it's very good for also you to kind of do an analysis of which kind of policies will affect the business you're building, the existing ones, and even the ones which may potentially come to exist. So for healthcare entrepreneurs, we are always encouraged that as you're thinking through sustainability and developing some solutions or building businesses, you should also be able to have some knowledge around the business models. Which kind of business model are you going to go for, and why are you going to go for that business model? Because through that, you're going to really be able to answer the part of the questions we asked about who's going to pay you and how you're going to remain sustainable within the field that you've chosen to play in. So just some iteration of this, we have most businesses trading with governments. For example, I'll give you the best example with Zipline. Zipline major client is the governments. So we'll call the business model to be B2G, business to government. The government is your biggest payer. We have businesses which rely on other businesses. So their models will be B2B, business to business. You're building a business, but your consumer is another business. For example, the most of the people were building LMIS systems, the learning management systems for hospitals and all that. They actually will give them to hospitals. The solutions will be given to hospitals or even the data platforms. If you have a supply chain data system, you're going to give it to a hospital so that your business model will be B2B. However, we have other businesses who are targeting the patient or the exact consumer. So their models will be B2C, business to consumer, or other people say business to client. The telemed platforms that allow a patient to directly log in and be able to put maybe some bookings and record their symptoms and all that. So the person paying them is the end user, and they pay them for the services they are going to get. So once you have been able to understand which kind of business model you are putting in place and for what reasons, you will be able to easily understand what will be your revenue model, because the business model will dictate the revenue model. Are you going to charge people for subscription? That's a revenue model. Are you going to do licensing? Are you going to do like complete ownership transfer? You're building a solution just for a particular use and then you do a one-time transaction. So there are different ways in which business models are going to dictate which kind of revenue model you're going to go for. And it's very important that primarily as you start off thinking about building a business, you're able to also understand that. Some businesses start by using blended business models. Others will pick one business model, then they're able to diversify later on. Depending on the context, you should be able to choose which kind of business model that you're going for. Then lastly, on sustainability, the different strategies which businesses uh, go for when it comes to building sustainability or building solutions which are going to be in the market for a long time. Let's say you're building a solution for Zambia and you are from Nigeria. You don't understand the local context of Zambia. However much you say you are all Africans, you don't understand it. So it's very easy for you to leverage on the local expertise existing to be able to use that technicality to be the kind of business that you want. The second part of it would be the clinical expertise that's existing. Use the clinical knowledge that you have as a healthcare professional to be able to know which kind of solutions will be sustainable or not within the market. The appropriateness of the technology being employed. Again, there are some technologies that are going to be outdated in the next 2-3 years. So it's very okay, or it's very good for you to be able to understand which kind of technology you're integrating within your solution. Financing models, of course, we talked about that. Who's going to pay? What is the feasibility of them paying 5 years from now? Such questions are very important for you to be able to remain sustainable. So there are many strategies that different businesses and even innovators employ to be able to define sustainability when it comes to the kind of solutions they're bringing to market or they're thinking to bring to market. Now, we talked about African challenges, which most of people know, but they also can be very great pointers to tell us as healthcare professionals, where should we build health businesses? Where is the immediate gap? And how big is the gap from an Africa standpoint? So I tried to come up with some 5 key areas, which if you're thinking about building businesses or innovations, they can be very good goal point for you to innovate within. It doesn't mean that the other areas not mentioned here don't really have value when it comes to innovation. No, I just pointed out the 5 depending on how big the market is. The first challenge we have, of course, the limited access to healthcare. We talked about the workforce and all that. If you're building a telemed venture, mobile health platforms, then there's a bigger market within that space. The second part of it would be the healthcare infrastructural gaps that we have. If we are able to build solutions that are going to optimize processes within facilities, for example, we have a bigger market to go for. If you're going to build solutions which are going to empower healthcare workers to be able to make faster decisions, to remote patient monitoring and all that. Again, that's an area that has a lot of potential when it comes to fixing some of the infrastructural gaps which are existing. The third one, we talked about the healthcare workforce challenge that we have within Africa. So if you're building a solution that's going to enhance some of the complementary models existing, for example, the community healthcare worker model, where governments are trying to focus on preventive health and not more the curative health, you have a higher chance of being able to build something sustainable. Remote training of healthcare workers or the healthcare professionals, education tools within the healthcare space, EMRs, all those are fixing the shortage of the human resource challenge that we have within the African setting. So it can be a good area for you to build a sustainable business within, because this challenge is not going away anytime soon. The fourth one is on the higher healthcare costs. Of course, we know accessing healthcare in Africa is quite tough because of the cost associated with healthcare services. So if you're building technologies that are going to enhance preventive medicine, then it's going to be an easy market or like a bigger market for you to tap into. Even currently, most of the governments have focused on preventive medicine. They're doing community care models. They're doing a lot of health promotion. All that is kind of a way to be able to prevent disease occurrence and not disease management, because management is always tough compared to the preventive aspect of it. Then the last one, we have a lot of misinformation when it comes to what is happening within the healthcare space, what is true, what is not true, and all that. So assuming someone build a solution that is able to fact check healthcare information, that's a big market. You're going to have globally, like everyone can be able to use such a solution if it exists. Or maybe someone has built a platform that is able to kind of elevate literacy among community healthcare workers or peer mentors or even healthcare professionals themselves. That's another venture that can be able to have a lot of success because the market is big. So there are quite a number of areas that we can innovate and build businesses within. And because of our basic foundational knowledge, we can be able to look at the healthcare systems we are in and be able to project which kind of market would make sense for me to build something within. Then healthcare entrepreneurship is an easy topic when you're talking about it, but implementation is tough. The implementation aspect of it has thousands of barriers that we know because of how Africa as a continent has been shaped. When we are in forums where we have global presence, people refer to Africa as if it's one country. They can just take these two Africans going to work. We are 54 nations. Every nation has their own system. You can't copy paste what is working to Kenya and take it to Nigeria and things going to work. It's going to fail unless there's a lot of customization that's going to be done. So we are running very different systems, and it's important for us to be able to identify which kind of barriers are existing in the systems that we are operating in. And even as we're building businesses within the healthcare space, we know which kind of challenges exist, and we need to be able to resolve them for us to scale. If Africa was a country, then fintech companies or even these telecommunication companies, they would be everywhere in Africa. MTN doesn't operate in Kenya. Safaricom, which is the biggest telecom within East Africa, doesn't operate in West Africa. It actually failed in South Africa. So that one tells you that we can have a very good business in a particular country, but that model can't 100% be replicated to another country and scale. So there are 4 challenges or barriers that I highlighted because of some reasons I'm going to discuss about, but we have many other challenges depending on the space that you're working in. So the first one, we have a limitation in terms of funding and investment for African-born ventures. We know that it's common knowledge. What brings this one? The perception of the risk that the debt burden in Africa is high and all that and all that. But it's also a good problem because it calls for homegrown solutions. We need to encourage a lot of local investment. The government should be able to invest in solutions which are being developed within their countries. We should come up with African-based venture funds. I've seen quite a number of them coming up, which something that makes me happy because we are slowly realizing that we can't lend the future to someone else to come and fix it for us. We need to be the ones who are fixing it. So for the investors within the African space, the limitation of the funding has become a major challenge, and most of them have seen the need to step in and be able to supplement the startup ecosystem. So we know if you're building a business that's going to depend on funding, then you know that accessing funding is not as easy as for developed nations. But there is progress in terms of us being able to see some governments even building startup initiatives like in Rwanda. They have an entire act, the Rwanda Startup Act, is trying to build some innovation ecosystems just to be able to encourage founders and innovators to build solutions for the existing challenges. The second barrier that we have, the weak infrastructure, of course, that we talked about. 60% of rural clinics in Africa, they don't have access to fridges. Why? Because they don't have access to electricity. That's according to UNICEF. So that one tells you that the infrastructural setup is also going to be a determinant in terms of how successful the kind of business you're building is going to be. But again, it's a good problem because through that, we've seen innovations which are now using advanced technologies that are able to surpass these infrastructural challenges that we have. For example, Zipline. They're using drones to be able to deliver medicine to whichever location that you are in. It doesn't matter if the roads are bad. It doesn't matter if you don't have the fridge. They're going to get you the vial of vaccine you need to do the vaccination of a kid or to take care of an emergency if you have it. Life Bank in Nigeria, you know what these guys are doing in terms of the access to blood and other life-saving commodities. A very innovative thing. And also it gives, this problem gives us space as healthcare professionals who are working within the government systems to be able to advocate for healthcare investment so that governments can be able to put more money in building these systems that we know it will become very easy for us to build solutions within. The third challenge, which I think should have been the first one, is the regulatory challenges that we have. Most countries in Africa, they don't have guidelines built for regulating innovations. For example, the telemedicine world is quite complex. There's a lot of trade-off between the quality of the services being provided and the impact telemedicine platforms are providing. And without a good regulatory framework, then scaling within such an ecosystem is going to just depend on factors which wouldn't really merit success when it comes to building a business. So the regulatory challenges that we have made it somehow difficult for some innovations to be able to scale within Africa. And that's why we have successful businesses in one country, but they can't cross the border and be replicated in a different country. But again, these are good problem because we as healthcare professionals, now we have to rise up and do a lot of advocacy, create a lot of advocacy groups and forums, and be able to influence policy change, be able to influence creation of new guidelines and new frameworks that can be used to guide the spaces that we're innovating in, if at all the guidelines don't exist. At the same time, we've seen some countries, like in Kenya, the Digital Health Act of, it should be 2023, the new Digital Health Act, has given an allowance for some innovations to be piloted even if they have not gotten 100% regulatory approval. Because we know that we have some innovations that you have to take them to market for even to be able to evidence the impact. So because of that realization, some countries are being able now to relook at the guidelines existing and create an avenue where these businesses can come, have their MVPs go to market and be able to validate if it's something that can be sustainable or not. Then the fourth challenge, of course, the market fragmentation that we talked about. Africa is not a country like people refer to it. We have 44 nations, different guidelines, different governance systems, and all that. It becomes a challenge in terms of scaling of innovations, but also it becomes a call for us as healthcare entrepreneurs to be able to build models which can be replicated. You need to build models which are scalable. Let's even take out the replication part, which are scalable. Because if a business is scalable, it is easy for it to come and go through the normal regulatory challenges and regulatory guidelines, and then it can get established. There is a telemed company, I'm trying to remember the name. I think it should be Tibu Health. It should be Nigeria, and it's also in Kenya. The founders, the co-founders, one is Nigerian, the other one is Kenyan. So they built the MVP in Nigeria. They did some work in Nigeria, it worked out, and then they now brought the business to Kenya, which has been quite working well in this telemedicine platform. So that one also becomes a challenge in terms of is it possible that we're able to build businesses which can be scaled across the original borders that we focused on? So that will be part one of my presentation, which has been more of business, entrepreneurship, the challenges existing, the opportunities, and all that. Part two of this presentation, which should be quite short, is more focused on what should we do. We are the healthcare professionals. We are in the system. We have the leadership role in terms of being able to actually take the mantle and build something that will be sustainable, because we understand the system, we are the advocates, and broadly, we are even the consumers of most of the businesses or innovations that are coming to market. The big question becomes, most of the healthcare businesses in Africa, they don't last beyond 10 years. They fail even more, some of them even before 5 years. Why is this happening? Some of the factors we've talked about them in our previous discussion. But part two of this discussion should be able to answer some of these questions in terms of why are they failing and what should we do as healthcare entrepreneurs or upcoming innovators within the system. So the burden of leadership falls squarely on the healthcare professionals. Why is that the case? It's because as a healthcare professional, you are wired to be a problem solver. It doesn't matter where the problem exists. That's why even in the typical African setup, if you go to a village and you have a doctor somewhere, if there's a problem, they'll come and talk to the doctor, to the nurse, or whichever healthcare profession exists in that setting. Because the community already trusts that this person will have a solution. So the society has already been wired that healthcare professionals are problem solvers. And so we can't excuse ourselves when it comes to being part of the healthcare business ecosystem. We actually will make a lot of change if we were part of that system, because of the obvious reasons. We run the system, we are the key influencers of the system, and we are the key consumers of the services within the system. So in a typical healthcare leadership setting, a healthcare leader, who in these examples of the healthcare leader would be someone with a healthcare background. You are a doctor, you are a nurse, you are a biomed, or whichever thing that you are. Only 10% of your work is based on the position that you hold. And 90% of your work is based on the proactiveness of how best you solve the problems existing within that system. So if you consider yourself to be a healthcare leader and 90% of your time is not focused on the proactive solutioning of the problems existing, then that means you need to go back and revise that role because exactly you're not one. So the confusion around who a healthcare leader is and what is only 10% positional, but the leadership comes in when it comes to the actual execution of the tasks ahead us and the solution of the problems which are existing. And how do we see this? Doctors out here, they're launching telemedicine platforms. Pharmacists are building medical access platforms, supply chain systems that we are seeing. I've seen nurses who have started maternal health startups. There's one in Kenya, it's called Nurse on Wheels. They're saying no pregnant woman should die in a village because they cannot get to a facility. So they're using motorbikes or whichever kind of medium of transport existing to make sure that every person, every pregnant woman can be able to access healthcare services. So these are the leaders that are existing within our ecosystem. I've seen biomeds who are building, like we gave the example of the oxygen plants. I haven't seen another medical engineer as well who has built solar powered fridges. They are live in Kenya. So you have these areas where electricity is a problem, but someone within the system said, okay, fine, if electricity is the problem, sun is never a problem. We are going to build something that can utilize the renewable energy forms that are existing. So those are the healthcare leaders. And that is the burden of leadership that we bear as healthcare professionals when we are working within healthcare ecosystem. But why should we lead? That remains the big question. Okay, why should I lead? You should lead because you are the architect of the system. You have a lot of power to create change within the system because you're actually the key consumer of the services being provided within the system. And at the same time, it's very easy for you to drive the system towards the direction that is right. Again, the second reason why you should step in and lead is because you're already trusted by the community. The society is already shaped around you. And that's why doctors, nurses, laboratory technologists, everyone in the healthcare ecosystem, we have our code of conduct and we have some ethical guidelines that bind us. So because of that, we've already been trusted by the community. And if we were to step in and take leadership in terms of building these solutions required, no one is going to doubt us. The third one, you have access to the data that you need. If someone from an external entity will come and build a solution within the healthcare system, they need to come and sit down with you. They ask for data, they ask for opinion, all that. But you already have it at your disposal, unfiltered actual data from the patients or from the healthcare ecosystem. So it's actually very easy for you to utilize that data and use it to build a solution that will fix a problem that is existing. Then lastly, we have a dual view. We are in the system, but also we intersect with the market. So our blend of expertise is unmatched. Someone else who is going to come from outside will have to borrow the clinical expertise from us. But by virtue that we are in the system and also we intersect with the market, we already have two critical factors that will make any health business succeed. So why should we lead? The reasons are born within us. Like we have all the reasons which are already imprinted everywhere, and the outside world already knows. We also know that these are the calls and reasons why we should take leadership mantles within the healthcare ecosystem. But what is the exact role that we play? So we've said, okay, we need to take leadership because we are building the system, we are changing it, we are trusted, we have access to the data and all that. But what exactly will be our role when it comes to now taking the leadership in healthcare business? A healthcare professional like ourselves, you have the burden of innovating. We've given examples of some instances where healthcare professionals are building something. Nurses building maternal health startups, supply chain pharmacists renovating how demand and forecast looks like, all that. So our first role, we have to innovate within the system. Alternatively, we can take the active leadership in the system, and we need to create some contrast between the first leadership we discussed about and the leadership we are referencing here as a role. The leadership here would be you are the person on the forefront in terms of providing the guidance, either to junior professionals in that field who are also establishing businesses or trying to build something that should be scalable. You are using your expertise to be able to provide that guidance and mentorship to the entrepreneurs who are existing within our space. You even have to volunteer your expertise. That's now the burden of leadership for you as a healthcare professional. You have to drive policy change. Remember, we talked about many things, how policies affect the growth of businesses and all that. We have the space to advocate for policy change. And the critical one, we need to make a commitment for systems change. Because if we are not actively innovating, we are the ones who are adopting the solutions which are coming. If we don't adopt the solutions, the systems remain the way they were. So if we adopt the solutions which are coming, if we are not actively innovating, then now we are creating the change within the system that we are serving into. Lastly, we need to be advocates. And by being advocates, that means the patients already trust you, the system trusts you. So you need to also advocate for patient-centered solutions. We've seen, or I should say, I have seen some health businesses coming up and just robbing patients. If you do the analysis of what the exact value they're bringing on board, you don't see it, but they're highly priced. So we are the people in the system to be able to point out and say, this one is not a patient-centered solution because we need to protect the welfare of our patients. Also, we need to advocate for equity and sustainability. You're working for government. Government is coming up with a new initiative that you are supposed to adopt, but you know clearly that this initiative is going to discriminate or even cause more inequity in terms of access to services if we brought it to board. So you have a role in terms of creating fairness when governments or the systems we are in are programming within healthcare. And lastly, of course, better policies. The innovation space is very dynamic. We need good policies that can allow us to pilot some things. So if you're not actively innovating, advocate for the policies, especially if you're working within policy development organs of governments or other actors within our ecosystem. So those are like the three high-level roles of what we should be doing within the healthcare ecosystem as healthcare professionals. When you're talking about innovating, leading, and advocating, we can also look at it from two broader angles. Either you are in active entrepreneurship or you are in active intrapreneurship. Again, in the healthcare context, entrepreneurship, you're building something from scratch. So let's say you woke up today, there's a problem, and you are like, I have the resources required, this is a market I've identified, let me put a team together, we build something. That's entrepreneurship. You're taking the highest risk. High risk, but if it succeeds, the returns are also high. For intrapreneurs, they're actually innovating within an existing system. You're already working for a hospital. You are a good data analyst as a healthcare professional. You don't have a data system. You say, okay, fine, let me create a data system and I'm going to digitize 10 services here and make work easier. For that case, you are an intrapreneur. So there's no excuse in terms of I can't innovate, I can't do what. At least you are tied to a system. If you're not building from scratch, you have resources that you can leverage on to be able to build something that will create impact and make work easier for the generations even to come. Where have we seen successes? Of course, in Kenya, we have a company called Revital Healthcare that was built primarily by one supply chain pharmacist, and they are manufacturing medical consumables. This company was built during the time of COVID. So it was there before, but it wasn't very stable. It came out during the COVID time because that's the time we realized how are we even shipping syringes from developed countries. And someone was like, no, we need to fix it. And they were able to build a very good business that is thriving. If you look at their numbers at the moment, they're doing a lot of supplies within the African continent. So one of us has built something that we can evidence and it is succeeding. We talked about Life Bank in Nigeria, built by a public health professional. And they're causing a lot of impact in terms of enabling access to blood, oxygen, and other medical supplies required within hospitals. I know Mfama is a big name now in the African context when it comes to the pharma supply chain. Mfama was built also by someone who is not 100% in the healthcare space in terms of their background, but they leveraged on healthcare professionals to be able to shape the idea and bring it to market. So that's another example. We have Dabadog. If you look at the business model, one of the interesting businesses I've read about or followed through for some time now, they're actually doing something that is very simple. It should have been done 10 years ago. You want to access a doctor. In Kenya, we don't have, let's say, I want to access a particular specialist doctor. In Kenya, we don't have that specialty. I should know which African country has that doctor. And I should even check their availability and be able to book an appointment if need be. The reason why this was not existing 5-10 years ago, I have no idea, but now existing. Someone has taken lead and be able to identify a problem and now has fixed it. So whichever way, we have seen success directly from ventures which have been built by healthcare professionals or other professionals who have not had direct clinical experience, but they have partnered with healthcare professionals to be able to build something that we can evidence. So what can we learn from them and what is stopping us from doing exactly the same? The lessons are many. You need to start. You need to leverage on the collaborations that you have, the networks that you have. You need to invent within the system that you are in. Advocate for policy change. Capitalize on the problems existing. Someone saw COVID while others were hiding in their houses. Someone was building something to mitigate a problem that was to be caused because of such a pandemic. So we have all the reasons and all the resources that we can leverage on and be able to build something sustainable that's going to cause impact within the healthcare ecosystem in Africa. So what next? We've talked about many things, but now what is important is what next? What can we do with the knowledge that we have? We need to start now, and we need to start small. No one is going to fund an idea that doesn't exist. So you conceive the idea, you bring it to life, build something with the resources existing, leverage on the network that you have, be able to pilot the idea that you think is going to be the next game changer. If you don't pilot it, you can never know if it's going to work or not. Advocate for something. Then, now that we're already in the system, let's support adoption. We have innovators out here, other healthcare professionals who have built businesses and solutions that can fix the problems that we have. If we can be the ones identifying them and being able to call on the adoption, then that will be one of the best things that we do when it comes to supporting the healthcare business ecosystem. The second thing that we need to do, let's join incubator programs, accelerator programs. There are many. If you don't have the business understanding, at least someone somewhere has volunteered to be able to teach you the basic principles of building a business. Some of them are free. Innovate Health Africa offers free fellowships. Ligre is doing the same. Baobab Network is doing the same. At least I can bet on this, at least 75% of African nations have an accelerator program, or at least they are linked to a startup ecosystem or a startup development kind of program. So you don't have an excuse. Even most of them are virtual. Actually, 90% of them are virtual platforms. So you won't say, I don't know, physical barriers and all that. No. Find one that suits what you're building, join it. Even if you're not actively building something now, join it so that you can learn from other people that are building. And through that, you can be able to validate the idea that you have and see if it's going to succeed or not, if you are to take it to market. Once you have the idea validated in your head or through your peers, and you build an MVP, I can tell you someone might fund you to be able to scale it, or at least pilot it at scale and be able to get some actual clinical outcomes that you can use to build a case for further funding or something of that particular sort. Then the last thing we need to do, let's just network and collaborate so that we can co-decide. As healthcare professionals, we have a lot of varied skills. Maybe something that you're building, the consumer is going to be a nurse and you are a biomed. It's very easy for you to co-design that solution, because through that, you're also reducing the amount of resource investment you're putting in if you're to build it alone as an individual. So be able to find the right networks, look for people with the same mindset as yourself, and be able to co-build something together. If you have an idea, validate it together, and if you find a fit, be able to co-design it. It doesn't mean that you cannot build something alone, but the encouragement is it's also easy if you're co-designing whatever it is that you want to bring to market as a solution. Now, the hard facts that we take home in our presentation today. If you're building a healthcare solution or a healthcare business, you must think about sustainability. If not, it's going to fail. Doesn't matter the number of hours you spend in, the capital that you've already invested, it's going to fail. Because if someone is not going to pay for it, the community doesn't own it, the policies don't allow it, it's going to fail. The future of Africa depends on this generation, our generation. Because Africa, as a motherland, has invested heavily to grow the kind of leaders that we are. So if we don't create solutions for the Africa ecosystem, then the future generations are going to blame us. So we must stand for something. And what are we standing on? Being able to create solutions that are going to solve the challenges we see today in the African context and system. If you are a nurse, or you are a doctor, or you are a biomed, or you are a pharmacist, that's not the only thing that you are. You are the one who is designing the healthcare system for Africa. So if this failed, then you can't say that people didn't do X, Y, Z. No, you didn't innovate within the system. You didn't support solutions. You didn't adopt them. You didn't advocate for policy change, or you didn't advocate for more resourcing into the Africa health ecosystem. So the titles we bear in terms of our backgrounds and our professionals, they are not as important as what we are designing or engineering within the system. you better stand for the change you created within the system other than just saying, I'm a pharmacist. If we cannot innovate, if we cannot build businesses for the African health ecosystem, it means we are going to import solutions for our challenges. And we know that imported solutions are not going to work. They have not worked for centuries. They're not going to work tomorrow. So it's a more wake up call in terms of we don't have a choice actually, but to rethink, reinvent, and be able to create solutions which fit the challenges that we are seeing because we understand the challenges better than anyone else will come, spend years here and understand. Then, if we're able to do all that, we're going to innovate for Africa, in Africa, and with Africans. And that will be the best success story ever that we get from our generation. So, thank you very much. That is what I had to share today. If you want to link up with myself, I have my email here. It can be very easy for us to chat. You're building an innovation, you have a solution you're bringing to market, you don't know business stuff and all that. We can always think from a healthcare perspective and see how best to support each other as we move. So thank you very much again for the opportunity. Back to you for any questions or feedback.
Thank you so much, Luke. I was transfixed from the beginning to the end. I think this has been a very amazing session. You could see the professionalism, you could see the understanding and the grasp of the topic or the theme, and you could also see the passion that Luke has for innovation, leadership, and entrepreneurship in Africa. It's so wonderful. I learned a lot of stuff. Like I learned a lot of new things. When we started building about 5, 6 years ago in Africa, I started doing healthcare stuff, healthcare innovation stuff in Africa. It wasn't really so new. It wasn't really so. It was new. It wasn't new, but healthcare wasn't really popular back then. 2017, 2018, 2019. So we just jumped started building with enthusiasm and passion and all that stuff. And then down the years, we discovered that it's still about passion and enthusiasm. There's a place for there's a place for research, there's a place for understanding the market, there's a place for knowing your product, there's a place for knowing who's going to pay for your product. You understand? And all those things are very important for healthcare professionals. Like very, very important. We have a lot of questions, but because of our time, we will not be able to take everything. But I'll pick about 4 or 3. But before I pick, we have a few people we selected to join, and I want to ask if anybody has any questions for Luke before we move on to our own questions. Does anybody have any question? Does anybody have any suggestion, any comments, and all that stuff? The comments and the passion. Luke is an amazing person. Yeah, I just got to know him, and it looks like we're going to be doing a lot of stuff together because I see that he has that experience. That he has that experience that healthcare professionals need to know. I've had people come to me and say, "Yes, I want to build this stuff. I want to do that stuff," and I just laugh. It's not about the passion is good, right? Yeah. So we should not underplay the area of passion and interest. But most people don't understand that when you start building, are you able to continue? Like 6 months, 1 year, 2 years, do you still be there learning, iterating, learning, failing, learning? Because for us, there are products that we have been on for 4 years, 3 years, and they are good products, like they're good ideas, but there are certain things that we need to understand when it comes to building, especially in healthcare, that's very delicate and very close-ended. It's not like you're building in fintech, but in healthcare it's quite different. It's very different. You're not building phones, you're not building laptops, your innovations and your solutions are likely going to be used by patients. That's going to be used by consumers who are patients. Very, very, very private data, stuff like that. So it's a different aspect when it comes to leadership and innovation, and that's why it's good that you get mentorship. And Luke has actually opened up his small ecosystem that you can reach out to him. If you want to if you have an idea, maybe you want to consult with him. I don't know if he's going to charge you. And you can reach out to him if you have an idea. Yeah. So it's amazing. It's amazing, and we decided to make in fact, going forward, our webinars are going to be like this. We don't want we're going to do pre-recorded sessions, discuss a lot, edit them and make them available. Add a few people who are interested to join the session and all that stuff. Yeah, so we're going to we won't pursue. Hey, we want 50 people. No. We're going to just make it small like this and all that. So the question I have is a personal question though, and so must all healthcare businesses, like all healthcare businesses, must they be tech integrated or enabled? When the tech revolution now, AI is everywhere, AI and all that stuff. So if I'm going to build a healthcare business, must it be tech enabled or integrated? Like, must I have an app? Must I have a website? Must I have some tech gizmos all over the place trying to help me with my business? Is it possible? Is it necessary? Or I should just do the traditional brick and mortar stuff without having to invest or think about technology and all that stuff? Let me hear what you think about it.
That's a good question, actually. It's not a must that the innovation you're building has some tech orientedness. I'm going to give you a live example. So I have a friend of mine who I can actually say like a mentor of mine who runs a consulting company called Insights Health and Devices. So he is in the medical innovation space. What he's doing, he has built a system for scaling innovations within the public health system, right? So he has built a model that he's now using to scale innovations in the public sector. The scaling in the private sector and public sector is day and night difference.
Yeah.
Private sector, as long as you're able to bring profit to them and make their work easier, reduce their operational cost, you have it. The public sector is quite different. So the model that this guy has built, he calls it mountain model of innovation scaling. It's actually a system where his consulting firm is able to sit down with governments and be able to map what the challenges are. So they call it demand creation. They're able to identify what are the top 10 challenges in healthcare within this government. The government will highlight it. So the approach is government-led, but they are just facilitating it.
Mm.
So when the government has identified the 10 challenges, they ask them, what are the top 5 priorities? So the government will say, maternal mortality is our number one. We need to solve it. We don't want to see maternal deaths. Say, okay, fine. So the top 5 or the top 10 challenges are arranged in terms of their priority. From that, he will go to the market and say, this government or this state or this county has these problems. And they are looking for solutions which are able to address these challenges. So innovators who have solutions that can address those challenges are going to come up and pitch.
Mm.
And through that, these guys are going to pair the solution to the challenge existing. So the challenge has been created through their demand creation process. Now, the government won't have an excuse of not paying the innovator because this is their first priority problem that has to be fixed.
Yes, you're right.
And now for them, as the system enablers, this is now their innovation. I've created a system that has been patented. And so you see, it's a system within the innovation space. It doesn't have any technology kind of thing. It's just a
Yeah.
process.
Mm.
So it's not mandatory that when you think about health innovations and health solutions, you should think about integrating tech and all that. No,
Yes.
you just
Yes.
you just need to answer the question of, is whatever you are doing or whatever you've come up with, will it be replaced in 5 years if someone else was to re-engineer it with some technology in it? If the answer is yes, then you need to do some tech integration. If the answer is no, then you can be able to run a sustainable business without tech integration.
Yeah. Yeah, that's very enlightening, because when healthcare professionals hear of healthcare innovation, they begin to think about telemedicine, they begin to think about digital health and all that software and coding and development and all that stuff. And you can see that you don't have to do all that. A brilliant model like this that solves a problem will actually do a lot of work. So people need to understand that you can bring models to make it easier for government to understand what they need, make it
Yeah.
easier for hospitals to recognize their problems. So it's a model where you follow certain steps and certain principles. That is very amazing. That's very amazing. Thank you so much. So I have another question before I go to because we have some pre-prepared questions. So this one there is, what technologies do you think will be outdated in 2 to 5 years, hmm, that healthcare innovators need to take note of? So we understand that after COVID in 2020, when AI became mainstream, a lot of things started becoming obsolete. You understand what I mean? A lot of things became obsolete, and going forward, there are a lot of things that will still become obsolete. There are a lot of ideas, a lot of thoughts, a lot of technologies, that will definitely become obsolete. Though in Africa, we might still not, we might still depend on some technologies, even if they become obsolete in France, US, they might not really become obsolete in Africa because, we are still, Yeah. So what are those technologies that you feel as an expert in like the next 2 to 5 years will become obsolete and that healthcare innovators need to take note of and begin to adjust, begin to evolve, begin to understand so that they're not caught in the web. They're not caught behind time. Yeah. So what are those technologies that you feel might become obsolete in 2 to 5 years? 2 to 5 years, yeah, roughly.
Yeah, I think these are tricky one because I know someone might be building something somewhere, and
Yes.
we're just telling them that this business has
Has no future.
what will come in my mind would be, they might not actually become obsolete per se,
Right? Okay.
but they are bound to change in terms of how processes are run.
Okay.
Let's take up, even you see, they should not even be technologies. They can be actual businesses existing, right? Let's take an example. If I run a pharmacy that requires someone to physically come
Mm.
and identify the medicines I have, be able to make a purchase, and then, like, it's 100% traditional, right?
Yeah.
You have to physically go to the store, buy the product, get the product, and then go back home. I can assure you, in the next 5 years, if this person is still operating traditionally, they won't have revenue for
Mm.
most African countries.
Amazing.
And that's why you see, even pharmacies now, they have infused their operations with online ordering systems.
Yeah.
And they have also gone further extent and introduced last mile delivery options.
Yeah.
So if you're making an order, I can say, I want paracetamol. This is my location, and I'm willing to pay. They're going to give me an online payment system where I'm going to do all these things. I've made the order, I've paid for it, and I'm going to receive it without moving from my house.
Yeah.
So someone who wants to compete in the same space and is going to go the traditional way, that person is not going to succeed.
Yep.
Look at the other example, even for the normal hospital setting, right? One of the amazing projects I've worked on for the last 2 years have been to introduce technologies which are bridging the out of clinic care gap. Give you an example. If you have a high risk pregnant woman who, let's say, they have a high risk of developing preeclampsia or eclampsia, they need a lot of care in terms of monitoring their blood pressure, because any weird trends, if not arrested early, then we might lose the mother plus the kid.
Yeah.
So if you have a hospital that is seeing such kind of patients and they are not doing anything until the patient comes back to their next clinical appointment, and you have a competitor that has integrated a solution that will enable them to monitor the
Remotely.
blood pressure conditions
Mhm.
remotely, then that hospital is not going to have business at all. Their maternity wing is going to collapse.
Yes. Yes.
So the bigger concept for healthcare professionals who are building something or who are running businesses should be which kind of processes within the establishment must be digitized if they want to stay in business.
Yeah. Yeah.
You can't be in this age and era, you can't be relying on patients to come, they queue, and then you book appointments. No, that's not possible.
It's getting outdated. See that?
Exactly.
Mm-hmm.
So you need to find a way in which you are able to move with the technology as it is moving. When AI came, it changed quite a number of things. How do you analyze data? How do we take notes, even the clinical notes? How
Mm-hmm.
do we make prescriptions? All that was digitized, and now AI is supporting clinical workers to make some decisions.
Yeah.
In the midst of COVID, the traditional healthcare system, of course, suffered people not being physically present
Right.
at the facilities.
Yep. Yep.
The ones which were clever innovated. The ones which didn't died with
Yeah.
COVID, of course.
Mm-hmm.
Now, we're in a situation where we have social enterprises which are coming up and they are specializing in a particular field within healthcare. For example, maternity space.
Yep.
So you have a group of gynecologists who come together and they build a platform where they can see patients remotely
Yeah.
and be able to monitor them all through their pregnancy journey.
Yes. Yep.
When the delivery time comes, they go to a partner facility. So if you're operating the traditional model, you'll become the partner facility. So they'll come with, this is our patient. And they do delivery in your hospital and they pay maybe 10% of the money that they are
They
collecting.
go.
Exactly. In Kenya, we have quite a number of those models which are running. One of them is the innovation by a company called Malaika. They are focusing on maternal and child health, and they are doing exactly that. Although
Wow.
I think they have one physical location, but it
Okay.
is not like a fully built hospital. No, it's just small operational kind of work. But they are doing remote patient monitoring. They're doing all the patient connection and all that. When delivery time comes, they have partner hospitals, which are like the big institutions. They'll come to your facility, they deliver their patient, they'll pay you 10% of the money or whichever amount you agreed on. But now you see you lost this patient if
Yes.
you didn't digitize your processes.
Yes.
So some technologies or some businesses might not really be outdated in the next 5, 10 years. But if they don't digitize their processes, they're going to die a slow death because
Yeah.
competitors are coming up and they're now taking all the clients which they used to enjoy. So you
Exactly.
might reach a point where you have a standalone kind of establishment, but you don't have the actual consumer, and so you automatically have to shut down.
Yep.
So my advice to people would be, if you're running any healthcare business or you have done any innovation, you just need to look at the lifetime of it. Look at the life cycle of it. Which
Mhm.
process is outdated or will be outdated, and it has to be digitized. then go ahead and do that. It will make you stay in business. If not, then none of us know what the outcome will be.
Yes, it's amazing. Honestly, when you think about simple things like records, health records, 10 years ago,
Mm.
we were still not doing paper stuff. And if you had said that, hey, very soon, all these things will become computer, they were like, it's not possible. Now, if your hospital does not have a system of capturing patient records digitally, in 3 years, you are out of business. Unless maybe you are, even if you are in the remote villages, somewhere in the forest, there's still a way where with satellite, you can still have systems where you can store patient records and share them across. Like what's happening in Rwanda. Rwanda, they want to fully digitize their healthcare records by December. I don't know if it's possible, but it's a big one. It shows you that people are already thinking forward. And as a healthcare business, if you don't think forward, if you don't take the bold steps to adjust and innovate, you're going to go out of business. Yeah, so that's very interesting. We have other questions here, but our time is so fast spent. Well, what we can do is that I'll take one, and then maybe we can email you the others, then you answer them. When you answer them, we will attach them to the production of the discussion, then so that others can see. And if others have questions too, they can ask your questions directly. Then we can also share them. So I'll just take one. Okay, yeah. So beyond the obvious, what are some critical healthcare challenges in Africa that entrepreneurs are potentially not paying enough attention to, where true innovation will make a significant difference? I think you touched on this briefly during the discussion. Like what specific areas, what specific challenges are healthcare professionals in Africa not actually paying enough attention to? Like I like the example you give about the doctor in Morocco, Daba doc, what they did, and we're like, why wasn't anybody doing this stuff 5 years ago? Sometimes it just depends on courage and boldness, and idea comes, and you feel, can I really do it? You should just leave it aside. So, what do you think are some hidden, let me call them hidden areas that you think nobody's looking at right now in Africa, that you think healthcare professionals or innovators can actually begin to do something in?
Yeah, I think what actually comes top of my mind would be how we can make healthcare data accessible to everyone, right?
Interoperability,
Data
right?
access, exactly,
That's
exactly.
that's actually very true. Yeah, yeah, yeah.
If if we actually had the right focus, we need to innovate in that space.
Yeah, yeah.
Because we have pharmaceutical companies out here which are looking for feedback data from the patients who are using their products. They don't have it.
That's that's
We
that's
have exactly. We
hmm,
have patient who actually wants to make some analysis before they choose which kind of prescription they want. Because you're going to be in the next few years, we're going to be in a stage where the patient will say, I don't want this brand.
yes. Yep, yep.
And
Personalized
if
medicine.
someone
Yep.
was,
Hmm.
yeah, exactly, if someone
Yeah.
was to innovate and give that level of information to patients, I can assure you that person is going to make a lot of money.
Oh yes.
And people will be willing to pay for it because they can see the exact value of
Yes.
the service that is being provided. So healthcare access, data sharing,
Yeah.
information sharing is
Yeah.
one big thing.
Yeah, exactly.
The second one, again, still linked to that, I'll go back to imagine if you had a platform like ChatGPT that you can type something and you are 100% sure the information given is clinically validated.
Correct. Exactly. Hmm.
Because here we're talking about AI and we're talking about um, different management softwares and tools and all that. But are we seeing them have the accuracy we need and the precision we need in medicine? No.
Yeah. Yeah.
So if someone was to think about an actual library of medical information,
Accurate medical information.
accurate medical information,
Exactly. Exactly. Exactly.
everyone, I'm going to myself, I'm going to subscribe, even if it's a, I'm going to subscribe to that.
You see
Because
that?
there's a lot of information I need to validate and all that.
Yes.
And with the existing platforms, I can't trust the outcome that I'm getting
Exactly.
from this. The third one, I'm going to discourage what people think about an innovation is an app. Most of the time, when you see an innovation coming to our store, to whatever, the thing is, we have this app, you can download it. Innovations and apps are not, they're not similar. They're not even any closer, right? In fact, best innovations don't have anything to do with apps. If we can think about reinventing hospital processes,
Mm.
why should I go to a hospital and I need to move from the triad, then go to another, I don't know, some kind of room for consultation.
Mm.
Then I have to move and go to the lab for my samples to be taken out. Then I have to move and go to the pharmacy.
Mm.
Why am I covering kilometers in the same facility? So,
That's true. True.
if imagine if someone had an innovation that's going to reinvent how these processes run in a facility. I'm not very sure if one exists. I haven't come across one.
no, I don't think
But
so.
just imagine if we were to rethink about how hospital processes run.
Yeah. Mm. Mm.
Because remember, we said more than 40% of our people in Africa, they are living in rural places. Actually, 60%. They're rural populations. Most of them are underserved. That means the facilities they're going to, they're majorly traditional. So all the systems being run there, they are traditional. That's why a doctor will have to take 40 minutes to see one patient.
Patient.
If we were to rethink about the process flow of all the healthcare things that we do within facilities, I can tell you that might be another jackpot because we will be selling process as a service.
Yeah. Process
Like
service.
people,
I'm just hearing that.
exactly.
You know, that's
so
amazing.
so through that alone, we can be able to really cause a lot of impact, make workflows very easy and
Mm.
impactful in facilities, and be able to just someone will be able to make money. Hospitals can pay for it, governments can pay for it, and all that. The fourth one, which I think might be the last one, I think we need to reinvent and innovate within the medical education and training space.
Okay. Yeah. That's
Currently,
that's true.
we have people who, when they think about training and uh, education, they think about colleges, universities, or they think about some kind of online platforms. But there are very few platforms that are tailored to the challenges existing in a particular area, right? Let's say, for example, in Kenya, take an example. Maybe you have 500 cardiologists, right? All of these guys didn't train here. Most of them, they maybe didn't train here. They trained in other countries.
Yep.
For them to actively do their work, they'll need assistants. We have nurse assistants who are working with them. We have physicians who are working with them and all that. The only knowledge that these assistants are banging on is their normal clinical knowledge.
Mm-hmm.
But no one has simplified the specialist knowledge and gave them the right prerequisite knowledge for providing the support they are provided to this specialist doctor.
Specialist. Yeah.
Or even if you were to look at it from the community setup, governments are trying to implement community healthcare worker models. They want them to be active people identifying diseases before they are like beyond the manageable stages in the village.
Yeah.
Do they know how to scout these diseases? The training is very skewed. So if someone was to rethink about how can knowledge be simplified and given to special
Sure.
groups, then I
Mm-hmm.
think that's a model that governments will pay for, private entities will pay for, non-profit firms will pay for,
Yep.
because the impact is 100% seen by everyone across the
Exactly.
healthcare spectrum. So those
Exactly.
would be like my four breakdowns of what I think we need to put a lot of emphasis now. And most of the people, or most of us in the system, we're not really concerned about. We know the are existing challenges, but either we have little understanding or we have not thought about investing in it.
Yes. True. That's very true. Yeah. Those are very, very Those are very, very powerful points I never really thought of. Because most times innovation just come as processes, how to shorten a process, make it more efficient, make it more effective. And the idea of data is the next goal. Data is gold. Anybody who's able to harness the power of data, especially healthcare data, he will actually be the next big person in healthcare. Just that data it comes with a lot of policies and all that stuff. But it's amazing. Thank you so much, Luke. I really learned a lot from this session, and it's an eye opener and making me realize that there are still a lot of areas that healthcare professionals still need to learn. That there are still a lot of things that they need to know. We cannot use 2 hours, 3 hours to discuss about everything. It's not possible. It's a continuous process. Thank you so much, Luke. And that brings us to the end of I think this is the longest we've had since we started. The longest discussion we've had so far in our healthcare leadership and innovation webinar, which seeks to bring healthcare professionals who have the experience, who have the expertise in healthcare leadership, innovation, entrepreneurship, branding, marketing, all has to do with healthcare, to discuss, to share their ideas, to discuss, to share their experience and their expertise. And our next session will be in the month of July, because we tend to have 1 month of break and we have another section. And the next session, we hope to also bring a very good guest who will be able to share their experience in the exciting and growing field of healthcare innovation, leadership, and entrepreneurship. Yeah, so we'll drop Luke's details in at the end of the video. You can follow him on LinkedIn, connect with him. He's very open. He's very, as you can see, he's somebody who is passionate about healthcare leadership and innovation. You can connect with him. If you have ideas you want to grow, definitely he's open to you, discuss with you. He can even, I don't know, can even mentor you if he wants, introduce you to some incubators. He works very closely with IHA. I happen to know IHA very well, and they are wonderful. You can join an incubator, help your ideas grow. You don't just build in isolation. You need mentorship. You need people who have gone ahead of you, who understand this thing, and people who are in Africa, which is very, very important, because I like the revival of homegrown African talent and leadership. I like what Ian Lua is doing. Flutterwave guy, he's pushing for funding should come from Africans for Africans and by Africans, not just um, external fundings that will tell us what to do with our money, but money from home, yeah, by leaders, yeah, Yeah, so thank you so much, everybody. Thank you for joining us. We'll drop our contact details at the end of the videos. You can join us. We are a healthcare media brand. Our job is just to make you understand leadership, innovation, entrepreneurship in healthcare, and we do it in various forms. We do webinars, we do reports, we do articles, we do research, we do content, we do outreaches, and all of that. Yeah, you can join us, find us on Facebook, find us on Instagram, find us on LinkedIn. All the details will be dropped at the end of the video, and you can also follow Luke too. It's available. Thank you so much, and have a wonderful weekend. Thank you.
Thank you.
Yeah.